Cytochrome P450 mediated drug metabolism, clinical implications, interactions, and management. Cytochrome P450 enzymes are responsible for the metabolism of greater than 50% of all approved pharmaceuticals, contributing to an estimated $45 billion annual economic burden from adverse drug events. Genetic polymorphisms in CYP2D6, CYP2C9, and CYP3A4 alter enzyme activity by up to 20-fold, creating predictable high-risk phenotypes for drug toxicity or therapeutic failure. The Roussel Uclaf Causality Assessment Method, RUCAM, score greater than or equal to 6, together with alt 5 times ULN, provides a quantitative framework for diagnosing drug-induced liver injury, DILI. Primary management combines immediate withdrawal of the offending agent, genotype-guided dose adjustment, and, when indicated, use of alternative pathways such as glucuronidation or renal excretion. Key points. Note: CYP3A4 metabolizes 50%, is almost equal to 450, of all marketed drugs, making it the single most important drug metabolizing enzyme, FDA 2023 data. CYP2D6 poor metabolizer, PM, phenotype occurs in 510% of Caucasians, 1-2% of Asians, and 0.5% of African Americans, PharmGKB 2022. Co-administration of a strong CYP3A4 inhibitor, e.g., ketoconazole 200 mg POQ12H, raises the area under the curve, AUC, of midazolam by 10-fold, is almost equal to 900% increase. Rifampin 600 mg PO daily induces CYP3A4, reducing simvastatin exposure by 70% and requiring a dose reduction to less than or equal to 10 mg nightly. NICE NG 123, 2021. The FDA-approved label for clopidogrel 75 mg PO daily includes a contraindication with strong CYP2C19 inhibitors, e.g., omeprazole 40 mg QD, because platelet inhibition falls from 60% to 30%, Triton TMI 38, 2009. RUCAM score greater than or equal to 6 predicts probable DILI with a positive predictive value of 78%, Jaundice 2020 meta-analysis. In patients with eGFR less than 30 ml/min/1.73 square meter, dose reduction of rosuvastatin from 20 mg to 5 mg daily reduces the incidence of statin-associated myopathy from 0.3% to 0.05%, HOP3, 2016. The 2022 ACC/AHA guideline recommends avoiding concomitant use of strong CYP3A4 inhibitors with rivaroxaban 20 mg PO daily. If unavoidable, rivaroxaban dose should be reduced to 15 mg daily, Class IIA, Level B. In neonates less than 7 days, CYP3A7 activity declines from 100% of adult levels to less than 10% by 2 weeks, necessitating a 50% dose reduction for drugs cleared by CYP3A7, e.g., tacrolimus. Therapeutic drug monitoring, TDM, of tacrolimus targets trough concentrations of 515 ing/ml, CYP3A5 expressors, greater than or equal to 1% allele frequency, require 1.5 to 2-fold higher doses to achieve target levels, Transform, 2021. Overview and epidemiology. Cytochrome P450, CYP, enzymes constitute a superfamily of heme-containing monooxygenases that catalyze phase 1 oxidative reactions for endogenous substrates, e.g., steroids, and xenobiotics, e.g., drugs. The International Classification of Diseases, 10th revision, ICD-10, code for drug-induced liver injury, DILI, is K71.2. while drug-induced metabolic disorders are captured under K71.9. Worldwide, an estimated 1.3 million adverse drug reactions, ADRs, are reported annually in the United States alone, with 15% is almost equal to 195,000, attributable to CYP-mediated drug-to-drug interactions, DDIs, FDA FAERS 2022. In Europe, the European Medicines Agency, EMA, records an average of 2.4% of all pharmacovigilance signals per year linked to CYP polymorphisms, EMA 2021. Incidence of clinically significant CYP3A4 mediated interactions is highest in patients greater than or equal to 65 years, 22% of hospital admissions for ADRs, and in those with polypharmacy, greater than or equal to 5 concurrent medications, where the interaction probability rises to 38%, JAMA 2020. Sex-specific data show that women experience CYP2C9-related warfarin variability 1.3-fold more often than men, or equals 1.3, 95% CI 1.11.5. Racial disparities are evident. African Americans have a 2-fold higher prevalence of CYP3A5 expressor genotype, tilde operator 45% versus 15% in Caucasians, influencing tacrolimus dosing requirements. Kidney 2021. Pathophysiology. CYP enzymes reside primarily in the smooth endoplasmic reticulum of hepatocytes, with minor expression in intestinal enterocytes, renal tubular cells, and pulmonary alveolar epithelium. The catalytic cycle involves substrate binding, reduction of the heme iron from phase superscript 3 to phase superscript 2, oxygen activation, and insertion of an oxygen atom into the substrate, monooxygenation. Genetic polymorphisms in CYP2D6, CYP2C9, CYP2C19, and CYP3A5 generate 4 principal phenotypes: poor metabolizer, PM, intermediate metabolizer, IM, extensive metabolizer, EM, and ultra-rapid metabolizer, UM. For CYP2D6, over 100 allelic variants have been catalogued. The 4 allele, a splice defect, accounts for 20% of PMs in Europeans, while the 17 allele, reduced activity, contributes to 5% of IMs in Africans. Enzyme activity is modulated by transcriptional regulators such as the pregnane X receptor, PXR, and constitutive androstenedione receptor, SAR. PXR activation by rifampin leads to a 4-fold increase in CYP3A4 mRNA within 48 hours, whereas SAR activation by phenobarbital yields a 3-fold rise in CYP2B6 expression. Post-translational modifications, including phosphorylation of CYP3A4 at serine 119, can reduce catalytic efficiency by 30%, J. Biol Chem 2021. Clinical presentation. Patients with CYP-mediated drug toxicity most frequently present with hepatocellular injury, ALT 5 times ULN, in 62% of cases, cholestatic injury, ALP 2 times ULN, in 28% of cases, and mixed patterns in 10%, DILI Network 2021. Classic symptoms include fatigue, 78% of presentations, anorexia, 65%, nausea/vomiting, 58%, and right upper quadrant discomfort, 45%. Jaundice develops in 34% of cases, typically when bilirubin exceeds 2 times ULN, greater than or equal to 34 mol/L. In the elderly, greater than 65 years, atypical presentations such as confusion, delirium, occur in 22% and may mask underlying hepatic dysfunction. Diabetic patients exhibit a higher incidence of cholestatic DILI, RR equals 1.4, P equals 0.02, while immunocompromised hosts, e.g., solid organ transplant recipients, present with a blunted ALT rise, 3 times ULN, despite severe histologic injury. Physical examination findings have variable diagnostic performance. Hepatomegaly, greater than 15 centimeters, has a sensitivity of 48% and specificity of 85% for DILI. Asterixis, flapping tremor, is present in 12% but has a specificity of 96% for severe encephalopathy. Red flag signs mandating immediate hospitalization include INR greater than 1.5, serum ammonia greater than 80 mol/L, and encephalopathy grade greater than or equal to 2, West Haven. The RUCAM scoring system assigns points for latency, risk factors, concomitant drugs, and rechallenge. A total score of 6.8 denotes probable DILI, while greater than or equal to 9 indicates highly probable. Diagnosis. A systematic approach to suspected CYP-mediated toxicity begins with a detailed medication history, emphasizing timing of drug initiation (IDOS) and known CYP interactions. Laboratory workup includes key points, serum ALT, reference 756U/L, values greater than 280U/L, 5 times ULN, suggest hepatocellular injury. Alkaline phosphatase, ALP reference 44147U/L, values greater than 294U/L, 2 times ULN, indicate cholestasis. Total bilirubin, reference 0.11. References 1. Zhao M. et al. Cytochrome P450 Enzymes and Drug Metabolism in Humans. International Journal of Molecular Sciences. 2021, 22, 23. PMID 348841615. https://pubmed.ncbi.nlm.nih.gov/348841615. DOI 10.3390/IJMS 222312808. 2. Brinkman D.J. et al. Pharmacology and Relevant Drug Interactions of Metamizole. British Journal of Clinical Pharmacology. 2025, 91, 7/2095-2102. PMID 403714556. https://pubmed.ncbi.nlm.nih.gov/403714556. DOI 10.1002/BCP.70101. 3. Heinegar et al. The Pharmacokinetics of the Nonsteroidal Mineralocorticoid Receptor Antagonist Finerenone. Clinical Pharmacokinetics. 2023, 62, 12/1673-1693. PMID 3787561. https://pubmed.ncbi.nlm.nih.gov/3787561. DOI 10.1007/S40262-023-01312-9. 4. Gogas P. et al. Potential cytochrome P450 mediated pharmacokinetic interactions between herbs, food, and dietary supplements and cancer treatments. Critical reviews in oncology/hematology. 2021, 166:103342. PMID 3393053. https://pubmed.ncbi.nlm.nih.gov/3393053. DOI 10.1016/J.Crittravonc.2021.103342. 5. Naknani R. et al. Systematic Review of Drug-Drug Interactions of Delta-9 Tetrahydrocannabinol, Cannabidiol, and Cannabis. Frontiers in Pharmacology. 2024, 15:128281. PMID 388686665. https://pubmed.ncbi.nlm.nih.gov/388686665. DOI 10.3389/far.2024.128281. 6. Royer B. et al. Pharmacokinetics and Pharmacodynamic of Alpelisib. Clinical Pharmacokinetics. 2023, 62, 145-53. PMID 366333813. https://pubmed.ncbi.nlm.nih.gov/366333813. DOI 10.1007/S40262-022-01195-2. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.